I'm Corporal Mossbrucker. I am a 12 whiskey carpentry and masonry specialist in the Army National Guard. I actually got to draw the floor plans that they're building out here, and so that's been pretty cool. I am in the interior design program in Gallatin College, so I've actually been able to apply my CAD skills to help out with the whole building process. It's been pretty cool to be able to be a part of this. Not a lot of people get to say that they've helped out with a worldwide pandemic, and to be able to do that military-wise has been pretty cool. So it's going to be cool to see the whole process once everything gets going.
My name is Major Juan Torres. I am the officer in charge of the project here. The project is a mobile modular healthcare facility as part of the state's phased reopening plan. The members that are here are individuals from the Montana Air and Army National Guard. What we're building here in this facility is a modular mobile healthcare facility that we're able to transport anywhere within the state to enable local hospitals to receive patients in case of an overflow incident. This facility could potentially go anywhere that it is able to fit in. So there will be electrical, plumbing, there will be nurses stations, there will be capability for a nursing call system, beds included. There will be as much privacy as possible that we can include in this facility, and overall the best quality of care we can provide with a temporary modular healthcare facility. Ideally, it's going to be an easy facility that anybody can pick up, look at the instructions, and put it back together. Simply put, we're all Montanans helping Montanans, and we're here to ensure the safety and well-being of everybody in this state, and potentially any others that need help. We are ready, we are willing, and we're going to get this facility up and running for those in need.
Okay, I am Sergeant Dylan Murray with the 230th out of Anaconda. My official job title in the military is Horizontal Equipment Operator. Specifically, my team is doing the plumbing, so the nurse hand wash stations at the beginning of each pod, we're running the plumbing for that, the waste, the venting, and all the water lines. It has been slow to start, but we've done a lot of the planning process, a lot of new experiences for me and a lot of the soldiers who are here. It's definitely interesting to see how each branch does their own thing. It's been a great experience. People are really nice. Lots of good leadership going around, lots of good training. It's a huge training opportunity for me because as a civilian, I'm a plumber, so I bring a lot to the table in the plumbing aspect. So my guys who are in my team get a lot of experience that they wouldn't get from the military. I bring a lot more from my civilian job to the military for these guys as far as training goes. I've always just found it interesting to kind of be in the Guard. You do get to serve your community differently than like first responders and people like that. So it's a different kind of experience as far as from that aspect of it. Is not everybody does this. A very small percentage of people in the state are in the Guard, and you get to help in different ways than other first responders do.
I'm Staff Sergeant Clint Anderson of the United States Air Force, Air National Guard. I am with Vehicle Maintenance in the 219th Red Horse. Well, I volunteered because I am a civilian police officer, and this would be one of the other opportunities to not only serve my community, but to serve my state, and goes without saying, to serve my country, and to see where we can help people at the most, to mitigate any further risk of overflow in our hospitals. We've been tasked to essentially build a mobile hospital in the hopefully circumstance that we don't have any problems with having this come back to us again, and then we, Billings is kind of a central station as far as helping out eastern Montana, the Dakotas, Wyoming, and the rest of rural Montana, and this could potentially be a 180-bed system that could hopefully we don't have to use. Individually, I am with the structures team, essentially just construction framing walls to build this mobile hospital.
I am Senior Airman Taylor Roberts. I'm HVAC, 219th Red Horse. I think it's pretty important. I think it's cool to be involved, and I'm proud to be here. So I am a part of the electrical team. So I don't know a whole lot about electrical, but it's been a good form of training for me, just because it kind of goes hand in hand with HVAC too. It's important to know electrical on the HVAC side as well. So I think it's been good for me so far. Yeah, it's been great working with the Army. I think it's builds a lot of camaraderie and a lot of unity between the two branches, between the Army and the Air Force. So I think it's a good opportunity for us to come together, and a bunch of good guys to learn stuff from us, as well as me picking up stuff from them. So it's kind of a good way to look at both sides of things. So it's been good. Being a part of the HVAC in the 219th Red Horse, it's helped me in the military side as well as the civilian side. So just multifaceted training, lots of really good, smart people in the HVAC shop.